All right, my name is Becky Crabtree, and I'm doing my 5th injection, which is an intramuscular injection Z-Track and reconstituting meds. So first, again, we start with the 6 medication rights, which is the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. I'm going to check my doctor's orders to make sure that the right medication is what we are using, as well as what time. For this particular one, we're actually going to make sure that it's the right diluent as well. You can use a number of dilutants, and so verifying with the doctor's orders the correct one is very important, and the type and amount is important. I'm also going to check my medical records to verify the patient and the allergies of the patient, if there's anything that this patient that catches my eye that I shouldn't do. So we're going to calculate ahead of time what we need to do for this particular medication. And this one, the doctor has ordered to have a 500 milligram per milliliter strength, which means I need 5.6 milliliters of diluent to be added to our medication. So I'm going to inspect the diluent and the medication to make sure that the vials are intact, that there's no cracks, that there's no particles that shouldn't be in the vials. Also, if they've already been opened, which the medication has not, but our diluent has been opened, so I'm going to verify the time, the date, and initials that it is within the 30 days or the time lapse that is appropriate for the particular diluent. So I'm going to go ahead and clean off the tops, pop off the top. Some people don't clean it when it's brand new. I'm going to just take the extra step to make sure it's clean. And I'm going to use a syringe and my needle. And I'm going to go ahead and withdraw 5.6 milliliters of air from my medication. Bevel side up at an angle, inject it in, and draw up 5.6 milliliters of air. And then I'm going to inject the air into my diluent, again, bevel side up at an angle. Inject the air. Now I'm going to flip it over and remove, and watching for air bubbles. My 5.6 of my diluent. Perfect. And then I'm going to put it into my medication, again at an angle. I'm going to recap this needle just because we are going to use it to withdraw the medication. I'm going to roll this, not shake it, to make sure that we dissolve our medication. This is where you small talk with your patient. How are you feeling? How are you doing?
Good, I'm good.
Good.
Thanks for asking.
Do you have a big day tomorrow?
Yeah,
And
not freaking out at all.
good.
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 Yeah.
I like that. Well, we're just going to give you a little bit of an injection here.
Cool.
Prepare for tomorrow. All right. Once that is dissolved, feels like that took forever. Now I will switch out the needle, which I'm going to
You have to hit it harder.
harder than that.
There you go.
Got it. Thanks, patient.
You're welcome.
I'm going to take off the needle, but this is the one I'm going to actually do the injection with, and put on this contaminated needle. All right, and then I'm going to total of 6 milliliters. No, wait, that is the volume. Oh, the doctor's orders was 1.5. So I'm gonna extract it to 1.5. Inject the air, and then flip the vial and extract 1.5. Again, watching for bubbles. All right, then I'm going to recap it. And I'm going to take off this needle, discard it in the sharps, and put on the actual injected needle. Then for this, I'm going to come to my patient over here. This is going to be an intradermal, right, intramuscular injection. And so we're also going to use her thigh area, her outer thigh. And we're going to look at the trochanter, and then it's going to be the femoral something or other linear muscle. Basically, it's about halfway between is a good, and you're going to triangle, and you want to hit, but you don't want to hit muscle, I mean, you don't want to hit veins or any nerves, so that's why you're finding the correct location. So when you do, also, you're going to displace the skin by about 1 inch to 1.5 inches by pulling back or forward as you inject, and then releasing so that it does the Z-track motion. I'm not going to actually inject my patient, but before I do that, I'm going to verify my patient in 2 ways, which I'm going to ask to verify who they are by stating your name and your date of birth.
Hannah Vlaja, 4'6" and 90.
Oh,
I should have been a fun person.
You should have, and I would verify in her wristband that it is truly the patient. Again, checking my doctor's orders and the amount of medication to administer. Did I wash my hands at the beginning? I washed my hands at the beginning of all of this. And then I'm going to wash them again before I do this as I glove up as well. So, as we displace the skin, here's my patient here on her little chair. And we're going to take an alcohol prep pad. Again, cleaning the site starting from the inside, working out, allowing it to dry before administering. Once it's dry, again, we're going to displace the skin with our hand. It's kind of hard to do on an orange. We're going to go in at a 90-degree, needle all the way in so that we are located correctly. We're going to slowly inject over 5 to 10 seconds. Oh, but I aspirated first and I didn't get any blood. Therefore, I am now injecting over 5 to 10 seconds. If I did aspirate, I would have to throw the needle away and start over again. So 5 to 10 seconds, I've injected and I come out. I'm going to discard in my Sharps Biohazard and then again dab if we have any blood. Do not rub or massage, and put a Band-Aid on. I'm going to document the site, the location to which I injected. I'm going to ask the patient how they tolerated it, document the amount, the time, the date, and as well as any side effects or indications, contraindications that they would let us know about. And that is that.